My name is Jordan Raymer, and both my daughter and wife have celiac disease. We've been impacted for going on 3 years now. My daughter was diagnosed after having been diagnosed with short stature, and shortly thereafter, within a few weeks, my wife was also diagnosed after a series of miscarriages after my daughter. Living with celiac disease and staying on a gluten-free diet is really not a simple thing to do, as you know, food is so much part of your life. Getting used to not being able to eat and things around you is especially challenging for a child who may be at a birthday party or friends' houses or school where there's just food that is filled with gluten. As a family that was diagnosed a few years ago, we were pretty astounded by how little information there was out there, both from the medical community and just awareness within the general population. Well, peer is really important. I mean, being able to have a private and a resource repository for information that the medical community can use to advance research is just extraordinarily important, because it enables research to be done in a cohesive and effective manner. So if there's a consistent platform or a consistent database of information for celiac patients, that can ultimately make a huge difference for the research that's being performed, and ultimately the outcome around diagnosis and hopefully treatments and cures for the disease. Over the last couple of decades, especially with the proliferation of the internet, people have become very leery of providing information especially that related to their health. Peer is really a solution to that problem. It's taking a database that has full privacy controls for individuals and their families to determine what information they want to share and what they don't want to share, and enabling the research community and the medical community to access that information for the benefit of the disease, and to advance the disease in all sorts of ways, including treatments, diagnostics, and hopefully a cure. I encourage everyone who thinks that they may have symptoms around celiac disease to get tested and to to make sure that they get the correct diagnosis. And if they do get formally diagnosed with celiac, to reach out to organizations like the Celiac Disease Foundation, and to participate in the peer patient registry like Peer to hopefully support this disease and improve the diagnosis rates and treatment rates. All of that will, I think, move us all toward a cure in the near future.